Hello everyone, I am Sanjana, Onco nutritionist from ZenOnco.io. Today we shall be speaking about nutritional intervention for gastric cancer patients. Let us try and understand what is meant by gastric cancer. Gastric cancer, which is also known as stomach cancer, is the cancer that starts in the cells which generally line the stomach. Now, our digestive tract is going to process the nutrients from the food that we eat and it will help in removing the waste from our body. Okay. So, where is the stomach located? The stomach is located on the left side of the upper abdomen that will help in the digestion of the food. Now let us go into see a bit of the mechanism how food is digested or absorbed in the body in very brief. Okay. Now the food moves from the throat to the stomach from a tube which is called as a esophagus. Now what happens when the food will enter the stomach? When the food will enter your stomach, it is broken down into the smaller particles, okay, by the stomach muscles, which are that will mix the food and the liquids with the along with the digestive juices. Okay. Now what happens is that after the stomach leaving the stomach, the partly digested food which is there, it is going to then enter into the large intestine. Now end of the large intestine is called as the rectum. So the it will store the waste of the digested food until it is pushed out of the anus with during the bowel movement. Okay. Now let us try and understand what are the various risk factors for developing a gastric cancer. First, it could be a H. pylori infection. H. pylori means Helicobacter pylori, okay, or a high salt intake or a high sodium intake, mainly from the consumption of more of processed food or packeted food or even regular outside food consumption, okay, or it could be because of a diet which is low in fruits and vegetables as well. So, how is gastric cancer diagnosed? Gastric cancer is diagnosed after using a CT scan or an endoscopic ultrasound or an endoscopy. A biopsy also could be done, a PET CT, and a laparoscopy as well. What are the common signs and symptoms of a gastric cancer? First of all, there could be a heartburn or indigestion. Okay, there would be a burning sensation in the abdomen which will occur. You will have a feeling of fullness even if you eat a small quantity of food. There could also be nausea or vomiting. There could be loss of appetite and a significant weight loss which is seen. Now, what are the various kinds of treatments which a doctor could, tell you to undergo? So, first of all, is surgery is the most common cancer treatment. Okay. Now, very small, which is stage one cancers that are limited to the inside of the stomach, can be removed with an endoscopy. Okay. Now, there could also be a subtotal gastrectomy procedure which is done wherein only the affected area or the part of the stomach is removed. Okay, in stage 3 or in stage 4 they do a total gastrectomy procedure wherein the entire stomach has been removed. So what happens now is that the esophagus is connected to the small intestine, the rest of it is bypassed because it the stomach has been entirely removed. So basically it is a gastric bypass surgery which is going to be taking place. Okay. Laparoscopic surgery is also preferred because it is less invasive and also it has been shown that the recovery rate is faster. Now, neoadjuvant radiation therapy can also be suggested to the patient sometimes before they go for a surgery. Why? Because it will also help to shrink the tumor size. This could also be opposite as well. So first they could also remove the tumor surgically and then they can carry out a radiation as well. Now, when a patient is going to undergo a radiation, there can be symptoms which they experience, such as diarrhea or even nausea or vomiting as well. So it is very important to understand the symptoms and also manage the nutrition. So now we are going to go into seeing what are the objectives of medical nutritional therapy. Okay, first of all, we need to prevent further weight loss and also malnutrition. We need to encourage good intake of fluids. Okay, we need to help in reducing the side effects of chemotherapy like nausea, vomiting, loss of appetite as well. Okay, after a surgery is performed, wound healing is important, so we have to promote wound healing by including anti-inflammatory and antioxidant foods as well. Next is we need to correct protein losing enteropathy. Now, stomach is an important organ wherein most of the absorption of the nutrients is going to take place. But what happens is sometimes not enough of protein is going to be absorbed in the body because of the underlying condition. So, during which the protein can also be lost. So it is very important to give additional nutrition support and to include protein supplements or a protein rich foods which are going to help in reducing the protein losing enteropathy. Next is we have to help them prevent the cancer recurrence, yes, which is extremely important. And along with that, we need to also encourage and help them to improve their quality of life. Now, if we go to see the patients who are having a gastric cancer are at a high risk of malnutrition, mainly because of the tumor progression. Malnutrition can also be a risk factor for post-operative complications, due to which it will cause length of the hospital stay to be more. There can be secondary infections as well. So early nutritional evaluation and early nutritional intervention is extremely important for these patients as well. Okay, now in the gastric cancer patients, okay, malnutrition is mainly caused because of a reduced food intake and cancer cachexia, which is mainly going to occur because of the cancer progression. All right, patients who generally have an advanced gastric cancer, okay, they can develop certain electrolyte imbalances or even dehydration as well. So it is very important in checking the lab reports, and based on that we have to ensure that what modifications can be done in the diet. All right, now today I'll be more focusing also on the important nutritional important micronutrients which have been important for these patients as well. Okay, now let us also go and see that what are the important nutritional indicators that are to be monitored before a gastric surgery is performed. The first important one is albumin, total cholesterol, CRP or your C reactive protein, which is an important inflammatory marker, and also neutrophils and your hemoglobin as well. Okay, now post gastric surgery, sometimes what happens is the patient is extremely weak, or even before going to a surgery the patient is weak, or they have a poor nutritional status as well. So and their food intake is less than 60 to 70%. Now during this time it is very important to give them alternative feeding method, which is called as tube feeding as well. And in severely malnourished patients, as per the ESPEN guidelines, it is recommended to give them total parenteral nutrition or peripheral parenteral nutrition. Then we can slowly bring them back to a enteral nutrition, which can also be tolerated. Now we are going in gastric cancer patients, they are at a high risk of developing micronutrient deficiencies as well. So especially after a gastrectomy procedure, your doctor is going to be prescribing you important micronutrients such as calcium, iron, vitamin B12 as well. So, what are the causes of micronutrient deficiencies in gastric cancer patients? There are three reasons. One is when you have an inadequate oral intake, it could mainly be because of the side effects of the treatment, or it could be because of loss of appetite as well. When there is an impaired absorption, when I mean impaired absorption, there is reduced absorption which is occurring, which can mainly be due to an intestinal failure or treatment related side effects like vomiting, nausea, or even loose motions as well. Now let us go to see what are the important micro minerals to be included. First of all is your B vitamins. Your vitamins are extremely essential because they are going to be serving as cofactors for the various enzymes which take part in the essential functions for energy metabolism, DNA synthesis, and even protein synthesis as well. Now, we are unable to generally synthesize most of the vitamin B on our own, and hence our body is dependent upon the diet for these essential nutrients. Now, both the folic acid and the vitamin B12 are majorly absorbed from the digestive tract, and hence in the gastric cancer patients it is very important to give them a supplementation of folic acid and vitamin B12 as well. Next is vitamin A, C, and E. Now, your vitamin A and E are your fat soluble vitamins, whereas your vitamin C is your water soluble vitamin. Now, patients who are having a gastric cancer mainly experience vitamin C deficiency due to a decreased oral intake, or there could be inflammation or an underlying infection as well. There can be losses of vitamin even during the treatment also. Now, vitamin C is an important vitamin which is also required for your iron absorption. So in gastric cancer patients, there can be reduced iron as well or low hemoglobin levels. So it is very important in understanding the micronutrient deficiencies and giving them timely nutrition intervention so that we can help to prevent malnutrition. Thank you so much for watching my video today. We at ZenOnco.io are here by your side to navigate you through your cancer care journey. In case of any doubts or queries, you can surely reach out to our cancer coaches on the below mentioned contact number. Thank you.